we decided to explore the facets of Black women's mental health. Our hypothesis is that the mental health system is radically different for Black women.
As the result of an American society that has historically provided few resources for African American women seeking mental health care, a system aimed to combat institutional shortcomings, self help, gained prevalence. Sisters of the Yam support groups, described by Bell Hooks in her book, Sisters of the Yam Black Women in Self Recovery, and other forms of interpersonal communication therapy are a necessary recovery tool for many Black women in psychological distress. It is important that Black people talk to one another, that we talk with friends and allies, for the telling of our stories enables us to name our pain, our suffering, and to seek healing, Hooks said. This meaningful communication among Black women has become necessary since the days of chattel slavery and remained crucial through the Negro Health Movement from 1915 to 1951 that largely ignored women's mental health as it pursued equal hospitals and qualified physicians. It was important in the midst of the Civil Rights Movement and when Ohio University was establishing a curriculum to teach African American studies, which only briefly mentioned the role of Black female nurses and left the realm of African American women's health, let alone their mental health, untouched. As Hooks describes, self-help and recovery by sharing feelings and personal struggles to form alliances is important to Black women when tools like medication, clinical psychologists, and extended hospital stays are impossible or inaccessible. In terms of solutions to mental health issues, the mental health system is radically different for African American women because it forces them to rely on self-help tactics. An article titled "The Successful Black Woman's Man Problem," appearing in 1980 edition of the New Pittsburgh Courier, suggested that the Black female problems are apparently compounded most during the young adulthood age, when the most crucial personal challenge is to make satisfactory love relationship. The article goes on to argue that the mental health problems of Black women are most prominent in their late 40s, when the most crucial personal challenge is to make a contribution to society that's equal to one's full potential. This information, put forth by an African American newspaper, highlights a societal pattern of trivialization of Black women's mental health issues. It asserts that any mental distress experienced by women is the result of not finding a suitable male companion, which implies women do not concern themselves with careers or higher level thinking. It makes light of real, debilitating mental health issues in Black women and contributes to the idea the mental health of Black women is not serious or worthy of attention and action as the mental health of Black men. This article shows that even within the Black community, African American women's mental health is not a priority. This is one reason, Hooks suggests, that Black women turn to therapy groups of and conversation with other Black women. She says that Black women's lives are far from peaceful and notes that stress is a hidden killer underlying all the major health problems Black women face. Through the communication of a unique set of shared experiences, each of the women who participate in therapy groups is able to lessen their burden. The idea of self-help by communicating with one another in a female network as a means of coping with mental strain is not a concept rooted in modernity. On page 40 of Sisters of the Yam, Hooks recounts the struggle of slave women who worked backbreaking jobs during the day, then returned home in the evenings to begin the second shift of housework and childcare. She states that this was often done without the help of male partners. Thus, they relied heavily on each other for help coping with both physical work and mental exhaustion. The stress that comes from trying to hold everything together, a job, a family, oneself, can be detrimental to the health of a person. Hooks repeatedly talks about the benefits Black women could reap from taking measures to reduce stress in their lives, including meditation and working against cultural norms that compel them to overexert themselves or be considered lazy. According to statistics available on the minorityhealth.gov website, non-Hispanic Black women had a significantly higher percentage of their populations experiencing sadness, hopelessness, worthlessness, and a sense that everything is an effort than non-Hispanic white women. When Black women can't remove stress, it can result in a variety of mental illnesses that sometimes lead to fatalities. The womenshealth.gov website lists mental health problems and suicide as a common top health concern facing African American women. A 1973 article on the Chicago Metro News focuses on the hidden crisis of Black suicide. Though the story points out that suicide is most common among young Black males, it can't ignore the rising rates of suicide among Black women. A recent study in California showed that the ratio of Black male to Black female suicides declined from 4 to 1 in 1950 to just above 3 to 1 in 1964. During the same period, the ratio of white male to white female suicides declined from 3.5 to 1 to less than 3 to 1, the article reported. This statistic, in part, is a clear indication of how the mental health care experiences of African American women are radically different than the mental health care experiences of white women. Further, in the decades just prior to the years noted in these ratios, Southern states were experiencing a dramatic lack of Black physicians to assist Black patients. Many white physicians would not accept Black patients. Among Negroes, in 1948, the ratio in Southern states was 6,203 Negro persons per Negro physician. The Negro Yearbook, kept in Ohio University's Mon Center for Archives and Special Collections, states, "A few African American women are mentioned in historical texts for making significant contributions to the medical community. The contributions of Estelle Massey Riddle, a nurse credited with breaking the color barrier in nursing during World War II, are listed as an essential material to be covered in a contemporary issue volume for teaching African American studies that guided curriculum in the program's first years. There is, however, no mention of the Negro health movement, of the public struggles faced by Black people, or the mental health crisis endured by Black men and Black women. The topic of Black women's mental health seems largely ignored in historical record, even, surprisingly, in an article on the mental health of Black people written by the women's editor of the Chicago Defender in 1974. The article discusses a sharp increase in the number of admissions to mental hospitals for different age cohorts of Black males and of white males. It mentions an organization working on behalf of the mentally ill, the Mental Health Association, and compliments an exceptional female member, Dr. Ruth Allen Foch. This woman was a retired educator, and though she worked passionately to aid those with mental illness, the article leaves many questions to be answered about how Black women fit into this narrative of mental health struggles for Black people. Evidenced by the previous examples, Black women were socialized to believe their mental health was something of little importance, and any mental health issues they encountered should be dealt with privately and quietly. The acceptance of the stigma of inferiority on the part of some minority group members can lead to impaired psychological functioning. An article appearing in the Ethnicity and Health Journal in 2000 reads, "The cultural characterization of whiteness as supreme and Blackness as inferior can lead people of color to perceive themselves as powerless and not worthy of the same access to mental health care as the white majority. This creates a cycle where Black women, already made to feel inferior by society, experience mental distress and feel increasingly more worthless. Thus, they don't or are unable to seek help from institutions and are forced to rely on a network of other Black women to cope. If you are made to believe you are inferior, you become inferior and accept the treatment you think you deserve. Stigmatization and long-standing stereotypes can also lead a person to believe if they don't fit the mold, they are defective in some way." Hooks offers a comment in her book about the myth of strong Black women. One aspect that continues to inform Black women's self-concept is the assumption that we are somehow an earthly mother goddess who has built-in capacities to deal with all manner of hardship without breaking down physically or mentally. She says this stereotype provides a convenient mask that hides addiction and mental illness. This, inherently, is a serious issue as it is another avenue to perpetuate the idea that mental illness doesn't affect Black women, or that it affects such a small number that it shouldn't be of real concern to larger society. It creates a situation that keeps African American women's mental illness an issue that only other Black women suffering from mental distress know the extent of and can fully understand. It limits resources for Black women and leaves them with only self-help and therapy groups as a true means of recovery. According to research facilitated by the California Black Women's Health Project, only 7% of African American women with symptoms of a mental illness sought treatment. This statistic is representative of the coping behaviors of Black women experiencing mental distress. These women prefer and are dependent upon female networks to communicate shared experiences and facilitate self-help and recovery from mental illness due to historical failure of institutions and broader society to acknowledge their suffering.
Well, it depends on why the person is attempting suicide. If it's a part of, in a child, if someone is imitating behavior, the outcome can be just as dangerous, but that's different from someone who is suicidal. For example, if they're chronically clinically depressed And one of the symptoms of their depression is that they become suicidal.
The particular perceptions of Black women permeate every aspect of their lives, including their interactions with mental health professionals and the mental health care system. Black women must navigate the waters of mental health by a different course than whites. The subjugation of Black people through medical practices, economic and social disenfranchisement, coping mechanisms, and misdiagnosis all create discriminatory practices in the mental health system. Therefore, racial discrimination and its consequences have rendered the mental health care system insufficient for Black women. John Henryism is a phenomenon which interacts with African American mental health in unique ways. Based upon the American folk hero John Henry, whose iconographic qualities embody blue-collar labor and the fetishizing thereof, the term is synonymous with high-effort coping mechanisms, i.e., workaholism, employed in the face of environmental stressors. In Sherman A. James's study of the relationship between hypertension, a stress-based ailment which contributes to somatic illnesses via blood pressure, he found that both Black men and women's John Henryism scores were near equal, 53.3 and 53.1 respectively. He proposes that Black men and women face near equal economic and racially discriminatory hardships and attempt to cope with these hardships through the adoption of Americanisms such as hard work and self-reliance to resist these oppressions. As proposed by Johnson and Crowley, African Americans are socialized in the mode of John Henryism and are therefore privy to experiencing somatic and depressive symptoms due to overwhelming taxation on their physical and emotional well-being. The work is healing mentality integral to John Henryism is inextricably fused with the archetype of the strong Black woman. Mays, Caldwell, and Jackson propose that admitting an intrapsychic problem cannot be solved by the self is the antithesis of Black ethnicity and values in America. Self-reliance, according to Black tradition, is synonymous with the Black woman. These perceptions hearken to respectability politics which arose post-emancipation. James describes this adoption as a cultural adaptation which addressed the creation of Black identity in America. The notions of self-efficacy and economic independence, bettering oneself and tugging on one's bootstraps, so to speak, are all part of respectability politics which do not accommodate the symptoms and diagnosis of mental illnesses. The combination of high levels of stress and high-effort coping, according to James, increase the risk of hypertension. Invariably, there is a definite correlation between the obligatory respectability Black women are susceptible to and the unhealthy internalization of John Henryism. Poverty and racial segregation creates a new facet which the mental health institution fails to address. Firstly, African American women and other minorities make up more than half of the non-elderly uninsured population and are less likely to receive standard routine care partly because they are in low-income families. Evidently, racially biased disadvantages implemented into the framework of America's economic structure are at work, as indicated by African American women's lack of access to, or limited options of, insurance. A lack of accessibility to adequate health care providers in their geographic area also lends to the underutilization of mental health services amongst Black women. According to Williams and Williams-Morris, segregation is the cause of economic disparity which impoverishes Black people. They found that persons in the lowest category of both income and education were twice as likely to meet criteria to be diagnosed with a major psychiatric disorder. This is indicative of an institutionalized structure which allocates sustainable medical resources to whites in white neighborhoods. Due to the phenomenon of white flight, these resources are allocated to white neighborhoods and institutions, thus creating an accessibility desert. Unethical medical practices have also created a pervasive sense of distrust amongst African American women. According to the JBHE Foundation, a research project conducted by the National Institutes of Health aimed to test a drug which inhibits prostate cancer. Although the organization wanted 20% of its subjects to be Black, they only tested 1 Black man out of 56 white men. The Journal of Blacks in Higher Education attributes this disparity to historical practices of eugenics upon the African American population, namely the Tuskegee experiment, which allowed 40 Black men to be untreated for syphilis for decades. The case of the Ralph sisters also demonstrated eugenic practices that were inflicted specifically upon mentally disabled Black girls. Mary and Minnie Ralph, who were 12 and 14 respectively, were subjected to tubal ligation overnight in a hospital after the coerced consent of their mother. Mary Ralph was mentally and physically disabled, and the sisters were described as old enough to attract boys. They were subjected to forced sterilization in the name of eugenic ideologies. In the Black community, suspicions linger about the real goals of medical research. Due to the tenets of white supremacy and its hand in utilizing medicine as a tool for subjugation, Black women cannot safely consent to leaving their mental health in the hands of institutions which have historically mistreated them. The psychological impacts of racism and discrimination are also facets of the Black psyche which have manifested as non-traditional in terms of the mental health institution. African American women's life experience is continually punctuated by the high mortality rate of African American men. Hunt says, the psychological impact attributable to high death rates of male family members cannot be ignored when looking at depression in African American women. This aspect of Black women's lives is a constant reminder that their family and themselves are targets of violent racism. In a study conducted by Versi and Curtin, members of disadvantaged groups who believe they are treated unfairly are more likely to have poorer self-esteem and mental health. According to Versi and Curtin, Black women reported significantly more instances of discrimination than white women. However, Black women's mental health does not quite hinge on self-esteem, as opposed to white women. Due to understanding their predicament in a white-dominated society, Black women are more likely to utilize proactive coping mechanisms to mitigate psychological damages racism enacts. However, that is not to say racism has no negative bearings on the Black woman's psyche. Finding that structural awareness mediates the relationship between discrimination and depression for all women aligns with the notion that knowing about power imbalances and not being able to do anything about them can in fact be stressful. Fundamentally, the Black woman's subjugation to racism is a key differentiating factor from the white woman and her treatment in mental health institutions. As demonstrated, Black women's mental illnesses and their intersections with structural and institutional racism is radically different than the psychology of whites. In mental health institutions, a common failing in preserving and improving the health of Black women is misdiagnosis. African Americans were more often diagnosed with schizophrenia, whereas whites were more often diagnosed with major depressive disorder. This is due to an overwhelming perception of a delay in seeking treatment as a more severe presentation of symptoms. According to Carrington, misdiagnosis of major depressive disorders in African Americans can be attributed to a lack of understanding cultural mores and folkways of expressions by the clinician. Delahanty, etc., concurred on this issue and found that more often than not, African Americans received a dual diagnosis of depression and schizophrenia 7 times more often than white patients. The authors insisted that the underdiagnosis of depression and misdiagnosis of schizophrenia amongst Black Americans are created within the context of white normative assessments. African American patients also express somatic symptoms of mental illness more often than whites, which causes even more complications in the diagnosis of Black patients. These physical discomforts are often voiced to physicians rather than psychologists. These failings to understand the differences in mental health implemented by racist and sexist structures are what fosters mistrust amongst Black women who refuse to utilize mental health institutions. Evidence of the discrepancies perpetuated by predominantly white mental health institutions can be traced to previous discussions. The internalization of John Henryism can be found in Bailey, Blackman, and Stevens' findings. Approximately 63% of African Americans perceive depression as personal weakness, and 31% believe in depression as a health problem. 30% also stated that they would handle their depression themselves, and only 20% said they would seek help from family, thus demonstrating the attitudes of self-reliance perpetuated by John Henryism contribute to the stigmatization of mental illness in the Black community. However, internalizing these methodologies of self-help often correlate with negative outcomes. Black people are more likely to seek emergency mental health services and are less likely to continue primary care treatment. Mistrust and fear of exploitive medications may also be factors in postponing or foregoing treatment. In a study conducted by Lays, Mendelsohn, Perry, and Tandon, perinatal women claimed they would not want to talk to a psychiatrist or other clinician in times of emotional distress. The reasoning behind their refusal is the thought that providers would immediately prescribe them medication. These women also feared a breach in confidentiality as well as fear of losing children to child protection services. This perception Black women have of mental health institutions harkens to the case of the Ralph girls. The wrestling away of the girl's sexual agency and medical rights, as well as the stereotype that the Black mother cannot be responsible for her own children, seems to be themes echoed in Lay's qualitative study. Sandra Bland, a victim of police brutality who died in police custody in 2015, also expressed her experiences in mental illness and utilized coping mechanisms typical amongst African American women. In her video blog series, Sandy Speaks, which are now archived on the Facebook page Sandy Speaks On, she shares with the world her experiences with depression and post-traumatic stress disorder. Autopsies stated Bland died by suicide. Although Bland had notified the officers that she had attempted suicide in the past, her family continues to refute this claim and believes she was killed by the police and framed for suicide. Considering her struggles with PTSD, the violence used against her by the police was not only an attack on her blackness, but an attack on her condition as a mentally ill woman. Bland, prior to her passing, had stated her faith was paramount in coping with her mental illnesses. She, like many other black women, had turned to the church in the face of mental health care, which likely did not accommodate her needs as a black woman. American mental health care's ultimate failure is its compliance in institutional and structural racism that has yet to be uprooted since the era of chattel slavery. Analyses of the intersections of racism and mental health care demonstrate that black women have fundamentally differing and often debilitating experiences in the mental health care system when compared to white women and men. There are two factors which minimize utilization of mental health services amongst black women: religious and familial social networks and mistrust of the system. As evidenced by analysis, the mistrust of the system fostered by its injustice against black women caused them to rely on mental health services crafted within their own network. Undoubtedly, clinical mental health service must address and accommodate black women's established coping mechanisms, system-related misgivings, and experiences with racism to truly benefit them.
I'm always so hurt when I look at our people and see the pain that's there. It is a hurt because it's so deep. It forces you to look at yourself. It forces you to look at the people you love. It forces you to realize that there's a big hurt out there, a big pain that I can't just easily fix, which is, I came in this field to help. And there's a lot of pain that people don't know. And so then it becomes my job to slowly help them see why they're hurting so bad, help them see that it was before you. It's bigger than you, it's bigger than your mom, it's bigger than me, it's bigger than Brooklyn, it's bigger than a lot.
When opening the conversation to discuss mental health, one cannot forget the significance of spaces where support can be sought. Institutions provide the care necessary when people can no longer treat themselves. These spaces are an integral part of this discussion. The major institutions related to mental health are formal mental health services and the church. People all over the country rely on these resources, and black women specifically rely on some more than others. The ways in which black women utilize, prefer, have access to, and benefit from institutions for support directly affect the ways in which they're able to receive help and sufficiently be active and healthy members of society. Professional mental health services like private therapists and community mental health centers are not the main source of support for most African American women. A study conducted by Cleopatra Caldwell found that of her sample of black women, only 10% consulted private therapists and 5% sought treatment at community mental health centers, while 44% of the sample stated that they had a need for assistance. As reinforced by a study by Romeria Tidwell, there is a no-show phenomenon among black women. They are generally less likely to show up to their scheduled appointments. They are also more likely to end their treatment before it is completely finished. This phenomenon supports the idea that black women are looking elsewhere for mental health support. They believe that they will be fine after only a single appointment, but realistically, that is not the case. If they're not returning to some sort of professional service, then they must be looking for support in other ways. Due to this, many mental health cases go untreated, which can be detrimental to a person's well-being. One particular reason for black women's lack of use of professional mental health services is distrust in healthcare. As posed in an article in the Chicago Defender, the inherent reluctance to seek out mental health care are the sense of resentment and guilt that are the heritage of colonialism and slavery. Centuries of disparity throughout all aspects of life have rendered blacks in America to a distrust of white institutions. Black women have been mistreated throughout history, and their health was never a priority, which brings into question the motives of the healthcare field today, as there are fewer studies surrounding them. It has been shown that non-African American clinicians were more likely to attribute paranoid symptoms to black psychiatric patients than African American clinicians. Studies such as these only cause the distrust to grow because misdiagnosis is so common due to the cultural incompetence. Adebimpe found evidence that blacks are more likely than whites to be diagnosed as schizophrenic, a disease which has a very poor prognosis, but less likely to be diagnosed with an affective disorder, which has a better prognosis. The reason for this has been found in numerous studies to be the result of misdiagnosis. A study conducted to observe whether or not ethnicity significantly correlated with misdiagnosis found that of 76 patients, 52 previously had been misdiagnosed as schizophrenic. If a physician is too overcome by their bias to provide sufficient and accurate treatment, there will never be a working relationship between black women and mental health professionals. A study by Whaley indicated clinicians have the ability to identify cultural mistrust in African American psychiatric patients. This opens the conversation for the need for cultural competence education in the mental health world that will lead to a higher sense of comfort for black women when they seek out these types of services. Though the same study also admits to the small amount of research on clinicians' level of cultural competence in making judgments about behaviors. This absence of research pertaining to essential factors in the healthcare field, which determine whether a clinician can actually complete their job effectively, continues a cycle of distrust for black women. Not only is trust an issue surrounding the institution of formal health care, but access is also a factor. Issues like childcare, transportation, employment, and general awareness hinder black women's ability to identify and access professional mental health facilities. According to the Office of Minority Health, only 9.4% of black adults received mental health treatment or counseling in the year 2014, compared to 18.8% of whites. An article in the Chicago Defender stated, African Americans have less access to mental health services, and those who are in treatment too often get lower quality care, and they, like members of other minorities, are underrepresented in mental health research. The article also goes on to blame the lack of access to mental health care on the shortage of insurance among the working poor. Insurance can be a huge barrier that prevents access to mental health institutions. If a person in need of treatment is unemployed or does not receive benefits from their place of employment, then it is less likely for them to be able to afford the attention that is necessary for them to cope. Also, some women simply do not know where they should be seeking this help. There is not enough awareness for mental health in these communities, which leads to a disparity in the treatment as well as the quality of the treatment that can be received. Another institution that is very prevalent in the lives of black women is the church. The church is a huge part of the black community and is there for assistance and support in all aspects of life. About 68% of blacks identify as being a part of a church in their community. According to a survey pertaining to ethnicity and disease, 43% of black women use religion as a coping mechanism over the course of a year. It has continually been shown that when mental health support is needed, black women are more likely to call upon their ministers for counseling. Almost 90% of blacks agree that they look to God for strength, support, and guidance. It may be easier for black women to seek help in this way due to the difficulty that they have in accessing and finding competent mental health professionals within the formal services that are offered to them. Reasons for using the church as a more convenient option for mental health care include the fact that it's free, the familiarity with the counselor, being able to speak to someone of their own race, and the therapeutic church experience. The definition of the therapeutic church experience describes the black church service consisting of confession of sin, fellowship, and the outward expression of prayer, praising, and singing. This external manifestation of emotion is often experienced as a therapeutic release that restores faith and hope. The combination of these factors that push black women toward the church as opposed to professional mental health options can be seen as positive, but it can also have negative effects on their health as well. Although religion is a great source for mental support, there are also pitfalls. A lot of clergy members are not trained to address mental illness. Hence, people relying solely on the clergy may not receive the necessary care or may delay seeking assistance from trained mental health providers. Ministers may experience members of the church that may or may not be battling mental illness, but they would not necessarily know how to handle this situation. They would attempt to provide support, but in some circumstances, professional treatment is necessary. Without proper training in the field of mental health, their assistance could lack the benefits that are needed for any real progress in treating a mental illness or disorder. This can lead to untreated mental health issues and worse problems for this person in the future. Though, if they were unable to find sufficient care professionally due to circumstances like inaccessibility, unfit clinicians, and lack of insurance, then it would most likely be more beneficial to seek support from their prominent religious figure. There may be pitfalls to religious support, but there are other factors to consider. The results of a study conducted by Karen D. Lincoln and Linda M. Chatters indicated that Black women who are religiously involved are less likely to have depressive symptoms. This finding supports the idea that religious practice has a positive impact on the mental health of Black women. The study also found that the impact of stress, including things like unemployment, racism, financial problems, issues with people within their family or social circle, worked independently of the positive impact of religious involvement. This could be used to argue that the effects of stress and religious involvement are able to counteract one another and create a sort of emotional balance. This also supports the notion that religious involvement, while positive, is not the best way to deal with one's mental health. The way that Black women handle their mental health concerns are based on various factors. The fact that there is so much mistrust and inaccessibility in the professional healthcare system leads Black women to look elsewhere for their mental health needs. The church becomes an important institution that they can easily turn to in times of need. Though the church is a great source of support, it is not the solution for serious mental health issues due to the fact that ministers are not trained in aiding mental illness. The education of mental health care professionals on cultural competence is imperative in rebuilding Black women's trust in their services. Rebuilding the relationship between these women and the professional institutions that are provided can help lower the number of mental illnesses that go untreated.
Before examining the consequences of untreated mental illness, it is important to understand what a mental illness is and what causes contribute to its development. According to the National Alliance on Mental illness affects a person's thinking, feeling, and mood. Mental disorders consist of several conditions, including depression, anxiety, personality disorders, and psychotic disorders like schizophrenia. The impact of trauma, oppression, and poverty make it more likely that a mental illness will develop in African American women. Also, negative socio-political experiences, including racism, discrimination, and sexism, put African American women at risk for low-income jobs, multiple role strain, and health problems, all of which are associated with the onset of mental illness. A study done by the Centers for Disease Control and Prevention found that 18% of African American women have feelings of sadness, hopelessness, and worthlessness. Untreated depression can lead to financial instability, strained family relationships, homelessness, incarceration, and in the most severe cases, suicide. When African American women are unable to obtain mental health care assistance through institutions such as hospitals or churches, and they cannot rely on self-help, they often experience immense levels of adversity. Many African American women do not have sufficient access to health care because of the location in which they live and their socioeconomic standing. It is difficult to confide in healthcare employees while living in a rural area that is far away from an institution. Also, having a lack of income makes it likely that African American women do not have reliable transportation to reach healthcare institutions, and even more likely that they will be unable to afford the evaluations performed, the medications that are suggested, and other forms of treatment that may be encouraged by the doctors. Distrust in doctors is also a barrier that supports the bridge between mental health and treatment. Compared to white Americans, African Americans harbor a strong distrust for physicians. African American women are significantly less likely to seek or receive treatment for depression than are white women because of their distrust of psychiatry and the medical system. Many African American women are skeptical of the healthcare system because they believe that as a minority they will be treated differently. Some fear that they will not be adequately treated for the illness or will receive substandard care. African American women have also reported instances where racism and discrimination have been present during their visit to a healthcare institution. A study done by Johns Hopkins Medicine found that 28% of African Americans thought their physician would be willing to ask them to participate in a study even though the study might harm them. 28% felt that their physician would willingly put them at an unnecessary risk, and 58% thought that physicians use medications to experiment on people without their consent. The relatively small number of African American doctors and physicians may also contribute to the distrust that African American women have in the healthcare system. In 2007, African Americans comprised 13% of the entire United States population. Of this percentage, only 4% were physicians. Not only do geographic and socioeconomic factors and skepticism contribute to hardships of obtaining health care, but there is also a cultural aspect that refrains some African American women from seeking the help that they need. Mental health is heavily stigmatized within the African American community. The African American community views mental health as being associated with shame and embarrassment. Therefore, many decide to hide their illness rather than seeking treatment. In the 1990s, a public opinion poll showed that 63% of African Americans believed depression was a personal weakness and only 31% believed it was a health problem. The Strong Black Woman Race-Gender Schema prompts African American women to use self-reliance and self-silence as coping strategies in response to stressors. Utilizing the coping strategies associated with the SBW race-gender schema could trigger anxiety and depression symptoms that may intensify when coupled with negative attitudes toward professional psychological help. Mental health is another form of oppression for African American women. Often they believe that mental illness will cause others to perceive them as weak or inferior. Shame, embarrassment, poverty, and the inability to find quality treatment all play a role in African American women's decision to not seek help. According to the National Alliance on Mental Illness, only about 25% of African Americans seek mental health care, compared to 40% of whites. Because of the stigmatization, many African American women seek out other coping mechanisms. Coping is how Black families store, retrieve, and act on information to function within or change the environment to meet their needs. When institutions fall short, African American women rely on group therapy, talking with other African American women who share the same illness, and by seeking advice and prayer through their ministers. When dealing with stressful situations, 90% of African American women reported a higher use of religious coping compared to only 66% of white women. In 2012, 43% of African American women used religion to cope with serious health problems, including depression, cancer, and heart disease. Only 28% of African American women with severe major depressive disorder sought actual treatment for their illness. Although some coping strategies may help some individuals get better or naturally stabilize their emotions, many coping mechanisms are too narrowly focused. Therefore, these alternative coping strategies are not always successful in helping African American women through their illness. Unfortunately, mental illness does not go away on its own. If not detected early, an illness will continue to progress, pushing an individual farther and farther away from their normal self. The longer a mental illness persists, the harder it becomes to treat. Mental illness that are not properly treated or go undiagnosed can cause African American women to suffer with unnecessary symptoms. They may experience unexplained stiffness or soreness that is caused when the body begins to overcompensate for the strain that the mental illness is placing on their body. When mental illnesses are left untreated, they have the ability to capitalize. Living with a mental illness makes it difficult to keep up with the demands of everyday life. For example, depression can cause an individual to struggle to get out of bed and go to work. It can also impair an individual's ability to communicate and interact effectively with others. Not showing up for work or performing poorly on the job can cause a person to lose their position. This job loss can lead to financial problems, which then can put a strain on the family. During hard times, intimate partner violence can become more rampant. Research suggests that African Americans are more likely to report experiencing intimate partner violence than any other racial group. The number one killer of African American females aged 15 to 34 was homicide at the hands of an intimate partner. Black women comprise 8% of the United States population, but account for 20% of the intimate partner homicide victims in the United States. Depression and financial hardship can also lead to homelessness. More than 1/5 of homeless people across the United States suffer from a mental illness. Of the total number of homeless, 42% of homeless people are African Americans. Although mental illness does not cause acts of violence, it does in fact make it more difficult to conform to the norms of society. Living on the street can cause a person to do the unthinkable. They may steal clothing or even food so that they are able to survive. Unfortunately, rather than treating them for their disease, those who suffer from mental illness are often incarcerated for their crimes instead. African American women are disproportionately incarcerated and experience worse health outcomes compared to white women. In 2007, over 1 million women were under the supervision of the United States criminal justice system. Of these, more than 200,000 were incarcerated in state and federal prisons. African American women represent 30% of females that have been incarcerated under state or federal jurisdiction. Women in prison are more likely than men to have been diagnosed with a mental illness. Nearly 3/4 of women in prison during the year of 2007 suffered from a mental health problem. Mental illness does not just affect an individual, but it also affects their family. Mothers who suffer from mental illness such as depression have the ability to severely affect their child's development. Children who are born to mothers with a mental illness are more likely to be exposed to poverty, violence, and fragile family relations. Over the course of time, children may become accustomed to this way of life and start to perceive it as normal. This can lead to an ongoing cycle of mental illness from mother to child in generations to come. If depression becomes severe enough, it can cloud a person's judgment and even make life seem intolerable. Over an extended period of time, those who suffer from depression will develop a lack of optimism and hope, which could potentially lead to suicide. African American women further describe depression as a sense of hopelessness, a pain that is so deep that one would rather die. Untreated depression is the leading cause of suicide among African American women. They are at high risk for suicide ideation and suicide attempts. Thankfully, many African American women will not resort to the extreme of suicide. African American women have the lowest rate of suicide as compared to all other demographics, falling just under 2%. There is a high rate of religiosity reported amongst African American women. Most religious teachings strongly discourage suicide as an option. Rather than opting for a way out, religious teachings promote hope and a sense of future progress. Because religious practices are so highly regarded in African American culture, suicide death rates are very low amongst African American women. When institutions and self-healing fall short as treatment for mental illness, African American women are plagued with many obstacles. High rates of depression can lead to financial hardship, strains within a family, intimate partner violence, homelessness, rising incarceration rates, and, in worst-case scenario, suicide. It is important to remember that mental illness is not a personal weakness, and it can be developed by anyone, regardless of their race, gender, or age. Rather than oppressing and discriminating against those who suffer from mental illness, society needs to empathize with these individuals. If society was not so quick to look down on those with mental illness, more people would be apt to seek help and less likely to suffer from these extreme consequences.
We found that Black women do in fact have different experiences in mental health services. Aspects such as misdiagnosis, poverty, incarceration, and institutional racism all impact their experience.
We chose to research mental health because mental health is a topic that doesn't get talked about a lot. And through our research, we learned that there aren't really a lot of studies about Black women and mental health. We felt that it was important to look at something in a new way that a lot of people haven't really paid enough attention to in the past.
Each and every one of us had the opportunity to learn about the intersection between the mental health care system, racism, sexism, and how they impact the Black woman and her mental health. I learned that African American women have developed incredibly applicable and thorough coping mechanisms that I had no idea existed. It made me realize that Black women's mental illnesses manifest in different ways from mine, and yet can be determined to have similar yet different symptoms. It really opened up my mind about how multifaceted and how culturally dependent the diagnostics of mental illnesses are.
Throughout the course of this research project, I have learned a lot about mental illness in African American women in general. Prior to this project, I never really thought about this topic or had much interest in it, so there was nothing I ever really questioned about the topic. However, since researching it a little bit more, I have found that African American women do in fact suffer from mental illness, and many of them do not seek health care simply because they are unable to. And, that could be due to the lack of income that they have, or even that they live in very rural areas, so they're unable to make it to the institutions that we have. And also, something I find extremely interesting is the large percentage of African American women who actually distrust the physicians that we offer. And I think this is partially because many of the physicians that we have are not African Americans. And so I think that if we increase the amount of doctors and physicians that were African Americans, all African Americans would be better apt to seek the help that they actually need.
I learned that mental health institutions have tremendously failed Black women in terms of accessibility to resources. Society at large has ignored the very real issue of mental illness in Black women and, as a result, prevented them from getting the care they need. I learned that self-help and therapy groups comprised of other Black women are essential to the recovery of those suffering from mental distress, and that these coping methods were developed in response to the deficiencies of traditional institutions.
Through my research, I learned a lot about how Black women cope and maneuver through a society that doesn't give them sufficient access to mental health services. They do, in fact, experience mental illness, but they have a distrust in white institutions that have, in the past, forcefully sterilized them, and many other atrocities that have rendered them, that have forced them that have forced them, and many other atrocities that have forced them to look elsewhere to take care of them, and many other atrocities that have forced them to look elsewhere to take care of their mental health. The historic imprint that has been left on Black women and the ways in which they've been treated in this society has caused the historical imprint on Black women and the ways that they've been treated in this society have directly affected the ways in which they seek help and cope today.